My name is Martin Serota, and I'm the Chief Medical Officer at Ultimate Health Services. I've been here for over 6 years now, and I've been in private practice prior to that for about 25 years. I've participated in organized medicine through the CMA for over 30 years, and I've been a member of LACMA for over 6 years. I really want to thank LACMA and the CMA for its support of private practice, support of organized medicine, and for support of patients over the years. But with that comes a lot of frustration because I think organized medicine could do more for private practitioners and more for patients. My biggest concerns have been as a primary care physician and an advocate for my patients that organized medicine has not done as good a job as it could. I think over the past it seemed like it's more interested in supporting specialty medicine, fee-for-service medicine, and with extreme positions it's taken, it's not really looked like it stood up for patients in particular. The scope of practice laws is an issue for me. Again, balanced billing is a big issue for me. So over the last several years, I've really tried to bring those concerns forward to organized medicine. LACMA in particular never really felt like my points were heard. Where LACMA has done really well is when we've worked well and collaborated. So we did a presentation 2 years ago on the Affordable Care Act, which I think was a good forum because we had an open dialogue about the pros and cons. I think that's when LACMA shines. But I think when dissenting voices are shut out, I don't think it's LACMA's greatest moment. So in the past, I've had the opportunity to speak with the CEO, the prior CEO of LACMA, and I just felt like I was more interested in selling memberships and maybe sponsoring events and less about really having my voice heard. This past year, there was an event that was right up our sweet spot, and I felt like we were left out of the presentations and out of the event, and it was only when we were being asked for a sponsorship that I heard about it, so that was really frustrating for me. Let me compare that to my experience with CAPG. So CAPG represents managed care, it represents organized medical groups, and is much more aligned with what I've been doing for the last 30 years. And I'm not asking that LACMA do the same thing, I'm just asking what LACMA do complement what CAPG does. So CAPG does not advocate for individual physicians, it does not advocate for private practice. So I think LACMA could do that very well and find a niche for itself without fighting all the policies that CAPG is trying to support and advocate for. My recommendation to the board is to really put patients first, and in putting patients first, develop policies around that. Supporting physicians in private practice and fighting very hard the corporate practice of medicine are things we can all agree upon. I think if we get a clearer message and stop taking very, very extreme stances, which honestly embarrass me as a member of organized medicine, and take more of a moderate approach, but keeping those two things in mind, putting patients first and protecting the practice of medicine for individual physicians as well as group physicians, I think will go a long way in restoring the credibility of the organization.